Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Imagine your immune system, the body's defense force, suddenly turning against your own kidneys. That's what happens in lupus nephritis, one of the most serious complications of lupus. Here, overactive B cells produce harmful antibodies that attack kidney tissue. The result? Inflammation, scarring, and if untreated, kidney failure. For years, treatment relied on steroids and broad immunosuppressants. Effective, yes. But they work like sledgehammers, suppressing the entire immune system. But now, things are changing. In October 2025, the U.S. Food and Drug Administration approved Obinutuzumab, marketed as Gazyva, the first type 2 anti-CD20 antibody for lupus nephritis. So, how does it actually work? Obinutuzumab is a type 2 monoclonal antibody that targets CD20, a protein sitting on the surface of B cells, the immune cells driving lupus inflammation by making autoantibodies. When obinutuzumab binds to CD20, it does more than just tag B cells for destruction. It actually kills them directly. Here's the interesting part. On a B cell surface, CD20 normally sits within tiny specialized regions called lipid rafts. You can think of these as little islands floating in the cell membrane, rich in cholesterol and other fats, where important signaling proteins gather. These rafts aren't proteins themselves. They're fatty patches that act as organizing hubs for the proteins involved in immune signaling. When obinutuzumab binds CD20, it prevents those proteins from clustering in the rafts. This disrupts how the cell membrane is organized and shuts down the B cell's survival signals. This causes B cells to clump together, activates calcium signaling, and disrupts their lysosomes and mitochondria. Eventually, those lysosomes burst open, releasing enzymes that digest the B cell from within, a process known as lysosome-mediated cell death. So, that's one way obinutuzumab wipes out harmful B cells. The other way? It calls for backup from the immune system. Obinutuzumab's Fc region is glycoengineered to grab on more tightly onto immune effector cells, such as natural killer cells and macrophages. These cells act like trained soldiers, efficient at recognizing and destroying antibody-coated B cells, through antibody-dependent cellular toxicity and phagocytosis. Together, these two mechanisms, direct cell death and immune-mediated clearance, help reduce autoantibody production, calm kidney inflammation, and slow the progression of lupus nephritis. The FDA approval was based on results from the Phase 3 REGENCY trial. In REGENCY, all patients received standard lupus nephritis treatment, typically steroids and another immunosuppressive medicine, but one group also received obinutuzumab. By the end of the trial, nearly half of the patients who received obinutuzumab plus standard therapy showed complete renal response, meaning their urine protein levels normalized and kidney function recovered. In comparison, only about one-third of those on standard therapy alone reached the same level of recovery. Patients on obinutuzumab also showed other clear signs of improvement. Their complement levels moved back toward normal. Anti-double-stranded DNA antibodies, a marker of lupus activity, went down. Protein in the urine decreased, and many were able to reduce their steroid use. Together, these results show that obinutuzumab not only helps the kidneys heal but also reduces overall lupus activity in the body. By selectively removing the B cells that drive autoimmune damage, obinutuzumab breaks the vicious cycle of lupus nephritis. It's a powerful example of how targeted immunotherapy can transform outcomes in complex autoimmune diseases. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.